Welcome to the Mercy Service Line in Atrium Health Mercy. We are thrilled to have you as part of our family. This presentation is meant to provide an overview of the service line and its leadership. The Mercy Service Line consists of 8 inpatient units across 6 floors. The first unit is 2 North, and it's a 26-bed observation unit and accepts patients with a wide range of diagnosis, including chest pain, GI bleed, and rule-out stroke. Included as part of 2 North, Horizons is an 11-bed, inpatient, voluntary detox unit with a common diagnosis of substance use disorder. 3 North is a 31-bed medical surgical unit. Most common diagnoses seen here are end-stage renal disease, altered mental status, and sickle cell. 4 North is a 29-bed cardiac medical telemetry unit. Patients admitted here have a common diagnosis of heart failure, chest pain, and rule-out stroke. 4 South is a 20-bed unit that contains 10 progressive beds and 10 med-surg beds. As a progressive unit, the nurses can titrate drips, care for patients with increased oxygen demands, continuously monitor patients, and has a nurse-to-patient ratio of 1:3. Most common diagnoses are respiratory failure, diabetic ketoacidosis, hypertensive urgency, and acute kidney injury. 5 North is a 26-bed surgical telemetry unit. Surgical populations include bariatric weight loss surgery, general surgery, urology procedures, and medical diagnoses such as GI bleed and small bowel obstruction. The intensive care unit is located on the 5 South wing. The ICU is divided into a medical side and a surgical side. Most common diagnoses include respiratory failure, end-stage renal disease, sepsis, diabetic ketoacidosis, and complications from surgery. 6 South is a 34-bed med-surg unit. Most common diagnoses include chronic obstructive pulmonary disease, diabetic ulcer, abdominal pain, and pneumonia. 7 North and 7 South together consist of 48 beds and are focused on musculoskeletal surgeries. Common procedures include total joint replacement of the hip, knee, and shoulder, spine surgeries, and shoulder procedures. Next, let's introduce you to some leaders in the Mercy Service Line. Lisa Hennigan is the AVP for the Mercy Service Line. Lisa has been a nurse for more than 30 years and has nursing experience in med-surg, intensive care, home health, and nursing leadership. Lisa's oversight encompasses operations for all inpatient nursing areas. Chris Neagle is the Director of Nursing Services for the Mercy Service Line. Chris has been a nurse for 25 years and has great experience in acute care and nursing leadership experience. Chris has oversight of the medical units and daily operations within nursing. Latasha Beelan is the Clinical Nurse Specialist for Atrium Health Mercy. Her work includes health literacy, policy and practice, Musculoskeletal Institute standardization, and clinical focus on delirium and fall prevention. Latasha has been a nurse for more than 10 years and has recently obtained her Doctorate of Nursing Practice. Meredith Gumbar is the Program Coordinator for COPD, Stroke, and Sepsis. Meredith has been a nurse for more than 15 years and has clinical experience in multiple areas. Crystal Lott is a service line educator and supports inpatient nursing with ongoing education needs. Crystal has been a nurse for 10 plus years and has spent time as a clinical instructor for pre-licensure students. And I'm Jason, the other service line educator for inpatient nursing at Mercy. My work includes onboarding and orientation development, professional development, and all things diabetes. And again, welcome. We're glad to have you as part of the Mercy family.